All right. Good evening, everyone. Good afternoon, wherever you are. Thank you for tuning in to the final event of today's Fight the Cut rally. We appreciate everybody who's been tuning in from early this morning through midday and now to tonight. As you guys know, there are some really big issues at stake. The PT profession is once again having to defend itself from cuts from CMS, both a 3.5% cut to PTA reimbursement or PT reimbursement, and then the PTA differential, which is a 15% reduction. Right now, it is so important for you to deliver your comments to CMS so that CMS knows you do not accept these policies. If you do nothing, it is essentially saying to CMS you accept their proposals. This is why they do notice and comment, so that you all have an opportunity to tell them what you agree with and what you don't agree with. So that's been the goal of today. Earlier this morning, we had President Sharon Dunn speaking about how important it is for us to come together as a community. We had representatives of the association, both PTAs and PTs, speaking around midday about how these policies are going to impact their careers and their patients, which at the end of the day is the most important thing, making sure that your patients continue to get these critical services and that we oppose these cuts from Medicare. So if we can tell CMS that we are opposed to these cuts, we can deliver significant relief to the industry at a time when we're still recovering from the pandemic. We're still battling the opioids crisis, and PT services have never been more critical. So please use our Patient Action Center to submit your comments to CMS. Tell your friends, tell your families. If they are a taxpayer, they have a right to tell CMS how to use that money and how to fund this program. So please get everyone involved. As you all know, we are trying to get 10,000 comments submitted to CMS before the September 13th deadline. Keep that date in your brain because we've got to keep working until September 13th. As you guys know, 10,000 comments is the goal. You're probably very anxious to know where we're at. So I'll go ahead and let you know where we are. We are just over 6,000 comments so far. That's fantastic. You guys have delivered more than 2,000 comments just today. And if we keep up this momentum to the September 13th deadline, we're going to get there. And we have a very significant chance to get CMS to turn around on some of these policies. And if they don't, we're going to keep fighting in Congress. So stay tuned for that. APTA's got some tricks up our sleeve. We've got lots of plans in place. We've already started the ball rolling with Congress. But I do want to introduce tonight's special guest. Very excited to have APTA CEO Justin Moore joining us to deliver a message to you all about the importance of advocacy. Thank you for your work. So I will go ahead and turn it over to Justin. Go ahead.
Great. Well, thank you, Kate, and welcome to everybody that's joining us online. And thank you. It's been a great day. We started bright and early at 9 a.m. and with President Sharon Dunn kicking off this virtual Fight the Cut rally. And we've seen a result today. We've seen it grow by several thousand comment letters, and we're going to continue this fight right up till September 13th. So just a great note of appreciation to all of you. Advocacy is a fabric of this organization. It has been since we were founded, and it continues to be a very important part of who we are and what we do, advocating for our patients, advocating for good policy to help appropriately reimburse physical therapists for the value they provide Medicare beneficiaries. Your efforts matter, and thank you for that. We are known in DC for being able to generate a lot of letters to Congress and to CMS, and you guys have built that reputation over many efforts, over many years, and this Fight the Cut is just one more area where we need your voice, we need your participation. Justin and Kate are going to do a fabulous job telling you all the resources that are available to engage your patients, to engage your family members, and I encourage you, if you've already taken action today, to do one more thing and ask somebody else to take action, whether that's a colleague in your clinic, whether that's a neighbor on your street, or whether that's a patient. Get one more person to contribute to this cause, because we know that physical therapy is needed for Medicare beneficiaries. We have growing number of individuals surviving and COVID and needing our care. We have individuals trying to manage pain that need our care. And we really need to be there for our seniors over the next couple of years. So thank you for that, and continue. The last thing is just thank you for being part of our advocacy network, part of our PT community. Our community is our collective strength. And when we go to the Hill, it is great to say we represent thousands of physical therapists and that are making a difference in individuals' lives, and be able to share that collective voice of this great profession with Congress and with CMS. So continue to demonstrate all the great advocacy you do, whether it's providing comments through this effort, whether it's joining us in our Hill Days, whether it's being, getting to meet your members of Congress or your state representatives back in your districts. Advocacy is critical for our future. It was a key part of our past, and we know that the best days for physical therapy are ahead of us, and we need your effort to make sure that this cut that's coming up at the end of the year, if we don't get CMS to take action, is going to be a minor step backwards. And so we need to keep pushing forward and keep making sure that our voice is heard and that we prevent further cuts to physical therapy. So I am honored to be part of Team APTA. But as we go through this exercise this fall, please know you have the right team here in Washington with your lobby team, your regulatory attorneys. We have the right message on this issue, and we have the right advocacy in you, our members, the patients you serve, and the partners that you bring along on this journey. So thank you once again, and keep up the fight. And we're going to work until September 13th. We're going to get all the comments we can possibly get in. Then we're going to start working with Congress, and we're going to make sure by the implementation of this fee schedule rule that cut is diminished, delayed, or hopefully defeated. So once again, thank you. And at this time, I'll turn it over to APTA's Vice President of Government Affairs, Justin Elliott, and our Specialist in Regulatory Affairs, Kate Gillard. Thank you.
Thanks, Justin. We really appreciate having you here tonight, and you deliver such an important message about how advocacy has played an important role in this profession from its beginning. I mean, you don't have to go far back to think about the wins we've delivered. Last year, because of you all getting involved, the cut was supposed to be 9%. We got that reduced down to 3.3. We're fighting it again this year. And, another thing Justin Moore talked about, too many Justins tonight, but Justin Moore's talked about, getting another person to submit a comment, telling a friend, telling a family member. We've come up with a really cool new resource to help make that easy for you. Because at the end of the day, we want this to be easy on you. We know that your priority is your patients. We want that to be your priority. So we want this to be as seamless as possible. So I think Justin Elliott's got a copy of our new resource that includes a QR code. You can see down in the corner, it's got one of those like black and white scanny codes. You hold your phone's camera up to it, and it takes you directly to the Patient Action Center. So if you print that out and put it at your front desk at work, show it to your colleagues at work, show it to your classmates if you're a student of physical therapy, take it around campus, show your neighbors, family, friends. It can be so easy for them to deliver comments as well. Isn't that right, Justin?
It is. We want to make advocacy easy. We want to make it something that, again, everyone's busy. And we want to make sure that it's 2 clicks. And with this new document, which, again, a QR code that you can share via social media, you can email it to friends, you can print out copies and stand on the street corner and hand them out to passerbys. We want to make sure that we are getting as many voices involved in this fight to submit comments to CMS by the September 13th deadline. And I think what's so important, Kate, we talk about, the proposed 3.5% cut for 2022. It's important to remember this is on top of a 3.3% we received this year. And it's on top of what will happen with the 15% PTA differential. It's on top of what's known as Medicare sequestration. We're looking at cut after cut, and it's really important for us to raise our voices to CMS, as well as later on we're going to be working on with raising our voice to Capitol Hill. And it is so important for us to get on the record with CMS to make sure that they hear us. And Kate, it's interesting. I was looking at some of the comments and just running some of the numbers out of all the comments that have been submitted now. And it's important to remember that every healthcare provider who provide services under Medicare Part B is supposed to be submitting comments to CMS on the fee schedule. Over 50% of all comments have been submitted by the physical therapy community. And so you look at that, I think that's a pretty impressive number.
Yeah, we've got allies in, skilled nursing facilities, folks doing home health, folks in rehabilitation agencies. We are seeing physical therapy mentioned in more than half of the comments that are submitted to CMS. We still want you to get involved and use our letter because, we know it hits the right points in the right places, but it is nice to see that folks across the board are coming out to say the cut to physical therapy, even though it's a cut to everyone, but the cut to physical therapy is just ridiculous when we're dealing with COVID and the opioids epidemic. This is just not the time to be cutting non-pharmacological treatment when people are suffering, losses in function due to being quarantined for so long, pain needs, etc. The profession is doing a great job advocating for itself, and we've got to keep the pressure on. Because the truth is, if we delivered 100,000 comments to CMS, they still might not give us everything we want. But APTA is not sleeping on that, right, Justin? Like, we've already started the work on Congress. We know we might have to get legislation involved. So can you tell?
Yeah, and as folks may remember, last year, APTA and a coalition of impacted providers lobbied Congress and worked with Congress, bipartisan effort that resulted in over $3 billion in new funding to the Medicare fee schedule, which reduced the cuts for 2021. Now, no cut is ever acceptable. And we got to make sure that we continue this fight. And Kate, as you mentioned, we need to make sure we get these comments in because, one, we need to make our voice heard to CMS, and we got to be loud with our voice on it. But what's so important about getting comments into CMS is that we know that we're probably going to have to work with Congress, and we're going to be seeking congressional intervention. And by having it on the record, by being able to say to members of Congress, we submitted thousands of letters to CMS, overwhelming response, and they didn't address our concerns. That's why we need Congress to intervene. And that's what we've been working on in terms of our Capitol Hill strategy. And we've been working on it actually since the beginning of this year. We got that additional funding in December. We turned right around and began making sure that we started educating the new Congress that came to town earlier this year that additional work is needed. We need relief for the short term for 2022, 2023. We need more funding to prevent these cuts. We also need more time because we need to reform the Medicare system. We need to reform outpatient therapy and the fee schedule. And that's going to take a little bit more time. And so while we are pushing for some short-term relief for 2022, for 2023 with additional funding, we also are going to be asking, it's time for us to really look at how therapy as well as other providers are paid under the fee schedule because it's not working. It's not showing value. It's not appropriately compensating and paying for particularly therapy services, which have so many downstream savings, which bring value to the system. And so we've been working, ahead of time with both individually APTA, talking to members of Congress, to committee staff, but also in coalition, because, Kate, as you mentioned, there's dozens of provider groups who are going to be impacted by us, not just us. It's, orthopedic surgeons, radiologists, pathologists, audiologists, SLP. There's a whole host of different providers that are slated for cuts as well. And so we are working with them as well in collaboration, in coalition, in anticipation of congressional legislation that we will need to do that will, again, be asking for additional assistance, additional intervention by Congress. And of course, one of the biggest things that we're going to be doing and this is one of the issues that we'll be bringing to Capitol Hill on Tuesday, September 14th on the APTA Capitol Hill Day. We're getting ready for it. Here's a copy of our briefing book that we're going to be utilizing in preparation for our meetings up on Capitol Hill. Again, educating and pushing Congress to be prepared to intervene legislatively, because, again, we need to make a big push with CMS and then be prepared for another push with congressional help. And so right now it's, end of summer, Congress is out, Labor Day weekend is coming up. But after Labor Day, things are going to start heating up on Capitol Hill. Comment period is going to close with CMS, and that's when you're going to really start seeing a lot of activity up on Capitol Hill with raising this issue, getting it on the radar, and making sure that Congress knows that they're going to need to intervene, and it has to be done before the end of this year, because if they don't, these cuts go into effect on January 1st, 2022. So stay tuned for that. Again, we have a very busy fall ahead of us on Capitol Hill. And, I said it once, I'll say it 1,000 times. This is a challenging time. This is a situation where we are recovering from COVID. We have multiple public health emergencies. And now we're dealing with multiple cuts that are on the horizon come 2022. But, when the chips are down and the challenges are on the horizon, the one thing that's great about the physical therapy community and about APTA members is we don't sit back and take it. We stand up, we fight for our patients, we advocate for the profession and the patients we serve. And that's what we're going to do this year. We're not going to let up. We're going to continue to advocate. This is why advocacy is important. This is why your membership is so important. We couldn't do what we do without your membership. So if you are a member, thank you for being a member. If you haven't renewed yet, please do consider renewing. And if you're not a member, please consider joining, because your membership is what helps us advocate and be able to carry this message to CMS and to Capitol Hill. And this is what matters. And this is the time to stand up, make our voice heard, and to advocate for the patient. So, Kate, I'm pretty fired up. We're pretty excited. We've got a lot of work ahead of us. It's a challenge, but again, we're better together. And when we advocate and stand up for our patients, we will win.
Absolutely. Thanks, Justin. Appreciate you being here tonight. I think you made some really good points about, we are working on a long-term fix. We know that it seems like year after year, it's the cut, and we have to keep playing defense. We are working on long-term fixes, but what you guys can do right now is get involved on this tonight before the September 13th deadline, submit comments, fight this where it is, give us some time to work on a longer term fix. Because you're right, the fee schedule is not working. We keep fighting it year over year, but we've got to protect what we've got. So we've got time to work on value-based care. We know that PT so dramatically changes people's lives. It improves their outcomes in the long term. And as the healthcare system continues to transform towards value-based care, eventually physical therapy is going to be a big winner because we deliver value. But in the meantime, we've got to defend our turf. We've got to advocate on these piecemeal year-over-year cuts. And it can be discouraging, but we have delivered wins in this space. We know we can do it. We've got to first deliver the message to CMS, then get ready to pivot to Congress. APTA is going to do whatever we can to make it easy for you guys to stay involved, stay up to date, and hopefully make it easy and fun for you to be an advocate. So obviously the folks who are tuning in here tonight care, they're engaged, they're going to print out the document with a QR code and take it to work tomorrow. But Justin, any final thoughts for tonight?
I think for the physical therapist assistants and students, again, thank you for your advocacy. Thank you for being members. And thank you for submitting your comments, and stay tuned, because again, we've got a lot of things we got to manage this fall. Along with all of these issues, we got a whole host of other issues we're going to have to manage as well. And this is where being a member of APTA is so important, and where advocacy is so important. So just really appreciate, again, everyone taking time. And everyone's busy. Everyone's got a lot of things going on, work, life, everything. So we want to try to make it easy for you. And so thanks for taking the time to do so.
Right. Thanks, Justin. Thanks for being here tonight. As a closing, I kind of want to echo what Justin said. Thank you. Thank you for tuning in. Those of you who are watching obviously care. You're obviously engaged, and you're ready to represent the profession, advocate for the profession, and most importantly, advocate for the patients that we serve, because that is ultimately the goal, is to improve people's lives, improve their health, their wellness, their overall life. So thank you for tuning in. We've got until September 13th. We've got, just under 2 weeks to hit our 10,000 comment goal. We've already got 6,000. I know we're going to do it, but it's going to take a little bit of work. Check out the QR code document. It's an awesome new technology everybody's using these days, and it's great to get that working for us as we fight these cuts. Also, stay tuned. There is going to be more work even after the fee schedule comment period closes, because as Justin said, we're going to have to pivot to Congress. We've already laid the groundwork there. They already know we're coming, but a lot of times Congress waits until they see the final rule before they act. But once that happens, we're going to hit them hard, and we're going to do whatever it takes to defend the profession and ensure that access to our services remains in place and our patients ultimately are not the ones who suffer. So again, thank you for tuning in. Thank you for being a member of APTA, and thank you for being an advocate for the PT profession and the patients you serve. So submit comments to CMS and stay tuned, and good night. Thank you.